Okay, good afternoon and welcome to the first session of a two-part series, Reducing and Diverting Plastic Waste in Biomedical Laboratories and Facilities. And I'm just going to get some slides up here momentarily to accompany this. I'm Megan Schultz-Spons, Executive Director of Northeast Recycling Council, or NERC. For those of you who are not familiar with NERC, we're an 11-state organization dedicated to minimizing waste, conserving natural resources, and advancing a sustainable economy through facilitated collaboration and action. We're pleased to be bringing you this series in partnership with Mass Recycle, who represents the state of Massachusetts, which is also home to the life sciences biggest epicenter in the United States. Today, we will discuss challenges and opportunities in biopharma and medical institutions. Before we get started, please note that this event is being recorded. A recording and a copy of the presentations will be sent to you after. I'm excited to introduce to you a wonderful group of speakers. We will hear from Avery Pilardi, Climate and Sustainability Director at Beth Israel Deaconess Medical Center, Sarah Dowdall, Program Director at Corning Life Sciences, Laura Capilucci, Global Sustainability Lead at Takeda Pharmaceutical Company Limited, BioLife Plasma Services, Jacqueline Hollins, Global Manager of Product Recycling and Innovation, Life Science Business, Millipore Sigma, and our session moderator, Gretchen Carey, President of Mass Recycle and Sustainability Manager of New England at Republic Services, who will guide a discussion following brief presentations. Before I pass it off to Gretchen, I would like to thank our sponsors, beginning with our presenting sponsor, Takeda Pharmaceutical Company. A bit about Takeda. Takeda is focused on creating better health for people and a brighter future for the world. They aim to discover and deliver life-transforming treatments in their core therapeutic business areas, including gastrointestinal and inflammation, rare diseases, plasma-derived therapies, oncology, neuroscience, and vaccines. Together with their partners, they aim to improve the patient experience and advance a new frontier of treatment options through dynamic and diverse pipeline. As a leading values-based R&D-driven biopharmaceutical company headquartered in Japan, they are guided by their commitment to patients, people, and planet. Their employees in approximately 80 countries and regions are driven by their purpose and are grounded in the values they've defined for themselves for more than 2 centuries. I'd also like to thank our gold sponsor, Polycarbon. Following the presentations and discussions, we'll have an audience Q&A, so you can submit your questions for the speakers in the Q&A box below on your screen. And now over to you, Gretchen.
All right. Thank you, Megan. Can you hear me?
Yes.
Yes. Okay. Thank you. All right. Thank you very much for joining us today, everybody. My name is Gretchen Carey, and I'm the president of Mass Recycle, as Megan mentioned, the statewide nonprofit organization dedicated to improving sustainable materials management. We focus on education, connection, and advocacy. And most recently, we've been working on combating recycling misinformation in the media by telling our own story. I am honored to say that I have been invited to run a roundtable at the upcoming NERC conference in Syracuse in October, and I hope to see you there. When I first got to know Megan as the leader of NERC, we quickly discovered that we both had spent time in the biomedical fields, although in very different capacities. Megan worked at Mass Biomed previously to joining NERC, where she managed relationships with life sciences partners who supported the implementation of hands-on life sciences lab activities in middle and high school classrooms. I have a degree in genetics and worked in research laboratories throughout Boston for a decade. Later, working in my current career in the waste world, those two experiences came together for me when plastic waste from laboratories was no longer accepted in the recycling bin. I set out to find a way to capture the clean plastic waste and ended up co-founding the company Green Labs Recycling. You will meet them in the next webinar of this series. While I volunteer as president at Mass Recycle, my day job is working for Republic Services as the sustainability manager for New England. There, I end up working with many biotech companies, hospitals, and higher learning institutions that create an enormous amount of laboratory waste. Many people in these facilities are striving to decrease this waste in some very creative ways. All of them have distinct challenges due to the various health and waste regulations they must comply with, making their progress even more compelling. I understand we have viewers from all over the country today, so I thought I'd give a bit of background on the waste industry in Massachusetts. In this state, we have a thriving recycling infrastructure backed by the Massachusetts Department of Environmental Protection, known as Mass DEP. We have what are called waste bans, which means that you're not allowed to throw certain items into your trash. These include metal cans, glass bottles, plastic containers, and paper and cardboard. Prior to 2018, laboratories and hospitals were instructed to put their glass and plastic solution bottles into the recycling bin after they were triple rinsed and the labels defaced. Pipette tip boxes, which hold the pointed plastic tips used to dispense exact amounts of solution, were also accepted in the bin. In 2018, however, Mass DEP created statewide guidelines for recycling, working together with the state's recycling facilities. Certain materials were no longer allowed in the bin, and these included solution bottles and pipette tip boxes, amongst other things. This was largely due to safety reasons. Some recyclers had gotten overly enthusiastic about recycling and were throwing in items like saline bags and the long tubing that goes with them. This tubing is something we consider a tangler in the recycling facility, as it gets wrapped around the moving and spinning parts and bringing the conveyor belt to a halt so that the tubing can be cut off by hand. I have also seen bloody items in the bin, frankly. And while many people were pristinely careful about their solution bottles when recycling, others were not. And we would occasionally find puddles of liquid on the floor that smelled strongly, and we had no idea what they are. Also, the plastic solution bottles were sometimes made of variations on number 1 and number 2 plastics, so that they would end up as contamination in our recycling bales. Therefore, in 2018, anything considered medical waste was banished from the bin. And I say this in air quotes because if you work in the medical field, that's not what you think of as medical waste. As the person training my customers to this change, it was emotionally very difficult. If there's any group of people who realizes we are all in one enclosed ecosystem on this planet, it's life scientists. They were very unhappy to think of trashing so much plastic. It is a common misconception that a person needs to have the word sustainability in their degree or job title in order to think sustainably. The fact is that anyone in any position or any field can strive to come up with new ways to make less waste, create better processes, design for circularity, and all of the other fantastic things that you're about to hear about today. In each case, all of these women came at their specific problems with a combination of skills that made them uniquely qualified to make progress in a challenging situation. Massachusetts is known to be a hub for biotechnology and excellent healthcare, so we had some great options for speakers for today's webinar. Megan and I went up and down the supply chain in choosing today's presenters, from design and manufacturing to end users. The format of this webinar will begin with the 4 speakers presenting for 10 minutes each, introducing themselves and their role in the field, and the place where their work intersects with sustainability. After that, I will moderate a panel asking questions of all of them. And lastly, we will open it up to audience questions through the chat. And Megan will present those questions to the panel or individual speakers. And with that, we'll get started. Avery Pilardi, would you like to speak first, please?
That sounds great. Gretchen, thank you so much for that history. Let me go and share my screen. I think I met you right after 2018 and that waste ban came into play. And so I've been since dealing with a lot of those repercussions in the healthcare setting. But hi, everyone. I'm Avery Pilardi. I'm the Climate Sustainability Director here at Beth Israel Deaconess Medical Center. And for those that, I guess, don't really know about Beth Israel, we are an academic medical center in which we are located in Boston, Massachusetts. So we are a teaching hospital with a research affiliation with Harvard Medical School. And so what this means is we have a significant research branch of our operations in which we have $230 million plus in basic and clinical research funding. We have active clinical trials occurring on site, as well as we have a significant clinical operations side as well. So we have 766 licensed inpatient beds, all of which really leads us to, there's a lot happening across our 2 main campuses in the Boston area. We have 3.7 million square feet and 2 main campuses, all of which ultimately fall underneath my purview and my department's roles and responsibilities. So I've been here for about 6 years. ultimately leading our organization in our sustainability goals, and really looking to operationalize sustainability. So ultimately facilitating collaborations across the organization to identify procurement strategies, processes, procedures, and programs to hopefully prevent plastics from entering our facilities. But the reality is we are in healthcare, we are conducting research, and plastics are needed in many ways. We can still prevent some. There is definitely a lot of plastic waste that does not need to be here. But once they are here, our department's responsibility is also to figure out how do we divert them. With that said, kind of diving a little bit further into where this conversation of plastic waste falls within our organization, it really falls underneath the umbrella of our zero waste goal. So for us, we've defined zero waste as achieving over 80% of non-hazardous solid waste diversion from landfill or incineration. So really a key aspect here is the non-hazardous solid waste. There's a lot of regulated waste streams that we are responsible for and ultimately don't have a lot of control over what happens downstream, and it's required by regulation how we're treating those. With that said, we do holistically look at materials management with this goal and want to make sure that we are tracking all of the materials that are flowing through our facilities and making sure we're not ultimately overclassifying any of our waste streams. So if we don't want to arbitrarily look like we're reducing waste on the non-hazardous side, when in reality, we could be just shifting it over to a regulated waste stream. And so we want to make sure we are educating employees on just proper use of all of those materials to make sure we are appropriately moving in this right direction for zero waste. With that said, we do have a strategic action plan that is being moved forward by our zero waste task force. What you see on the right-hand side is kind of our governance structure for sustainability across the organization. So we do have a variety of working groups and committees that are responsible for pushing forward all of our organizational goals. And plastics ultimately does integrate into a number of these different groups. But really, it's been our task force responsibility to be able to prioritize the strategies and actions that were outlined in our strategic plan and push those forward. So we have key departmental representation across the organization with 2 vice presidents as the co-chairs of that group to make sure that not only zero waste is a priority, but really ultimately this conversation of plastic waste. So we have been able to turn some of these concepts into action and have had some successes across the organization when we're thinking about plastic waste. You'll see probably more successes on the clinical side than our research side, and during our discussion of this panel, we'll be able to kind of go into some of the challenges, and I'll be able to talk a little bit more about why that may be. But this slide will be available for reference post webinar, so feel free to reach out to myself with any questions if you don't have a chance to ask them today, as I won't go through every bullet that is here on this slide, as there is quite a lot. I just want to focus in on a few. So starting at the top of this waste hierarchy and thinking about how do we rethink, redesign, and ultimately use our materials to the highest, best use. One of the initial, I'd say, wins of coming into Beth Israel back in 2019 was the opportunity to look at and really question how we were managing supplies that entered patient rooms. So at the time, and it's common practice across a lot of hospitals, is once supplies enter patient rooms, they're deemed as contaminated, and whether they're opened or not, they need to be thrown into the appropriate waste stream. So with that, in partnership with infection control and infection prevention, we took a deeper look at, is this the case for every patient room? Or is there an opportunity, because again, a lot of these things are wrapped in plastic, for us to be able to wipe them down if they weren't open and return to the stock room. And ultimately that was true. There was very minimal to zero risk of any infection transmissions, especially when we're talking about very low level precaution patients, to be able to ultimately change our workflow and make sure that we're actually using all of our supplies and not just wasting once they enter our patient rooms. So huge success, and I recommend all hospitals to pursue such a policy if you are currently have the standard of just wasting it all. On the reduction side, so for those that aren't very familiar with hospital operations, before surgical procedures, all of the equipment and supplies are sterilized and disinfected in preparation of patient care. And so in a lot of cases, a sterilization wrap is put around all of the instruments and all of the equipment in preparation for the case. It's a polypropylene. A lot of people refer to it as a blue wrap because it is the color blue. And so an opportunity here that we recognized was to actually be able to transition to reusable sterilization containers. So instead of having to wrap in a disposable wrap, and then ultimately it's one of the cleanest plastics that are leaving our facility, be able to fully or reduce the majority of what we were using. We still have blue wrap leaving our facility, so our next step is to find hopefully a recycler that will be able to process that. On the reuse side, so ice packs, and I'll focus now, switch a little bit into the research labs. So reuse for us it does get complicated, especially when you talk about needing to ensure that the integrity of research stays intact, as well as the quality of patient care stays up to the standard of care that we want it to be, which is extraordinary. And so a lot of times when we think about reuse, we actually are thinking about external partnerships and how can we leverage external organizations to hopefully help us in this conversation. And one of the successes that we've had here was in terms of ice packs. So we now are donating over 4 tons of ice packs each year to local organization, Smith's Country Cheese, which they're reusing our ice packs in their shipment. So there was a lot of work that went into this to make sure the ice packs we were receiving were able to be were food safe. And then obviously the training protocols to make sure that they were wiped down and before being sent out. But this has been, I'd say, a huge success in our research environment, in an area that our researchers have been heavily engaged. Last step on recycling, as that's obviously a big topic here, and we'll dive into a lot of the challenges on why this becomes difficult, but we have had some successes in capturing our pipette tip boxes in a separate waste stream coming out of our research labs, and are able to capture some plastics in throughout our operating rooms and our laboratories as well. But this is an ongoing journey to make sure we're collaborating closely with our waste haulers to make sure we are compliant with what they can and will can actually recycle. So, there's a lot of challenges, but one I want to show is just this visual of our waste disposal chart. So this is just a sample of how we communicate about all of the different waste streams that are within a patient care area. So you can see that there's a lot of different collection containers, a lot of different hampers, and this is already overwhelming, and never mind talking about a fast-paced environment in which there's also a lot of regulations behind these waste streams, and in which we need to make sure we're doing them correctly. And so the conversation about adding to this becomes very difficult. And so really a lot of our discussions have been, how do we push upstream to make sure, again, we're preventing this plastic waste from coming in and working with our supply chain as best as possible. But then ultimately, and we're not there yet, but I would love to see a future in which maybe there's a one-bin solution for healthcare facilities in which we have a partnership downstream that's ultimately sorting the plastics and diverting them to the appropriate recyclers. But one of our challenges will always be adding bins. In the research environment, we have less waste bins that exist, so we have a little bit more flexibility, which is where we've been at least able to add pipette tip boxes and the ice pack donations. But we'll hit a space and a time and place in which we're limited there. So I'll stop there. But really, I'm looking forward to the conversation after this to talk about any partnerships, third-party support, collaborations, because ultimately that's all going to be key for us to close some of our logistical challenges as we move forward. But thank you all, and look forward to your questions.
Thank you, Avery. Really appreciate that. Next up, we're going to have Sarah Dowdle. Sarah, welcome to the stage.
Let me get my slides up here. Okay. Hopefully you can see my screen now. Okay. Let me know if there's any issues, Gretchen. But it's, again, Sarah Dowdle from Corning Life Sciences. So we are a supplier to the research lab. So folks like Avery and Laura are our customers. And I will talk in my presentation a little bit of an overview on how we do sustainability top down from our business, because we are a part of a larger Corning Incorporated, and how that flows through to life sciences. Okay. So we think about, at a corporate level, our environmental footprint in two categories. So first is the footprint, which are direct actions and how they impact others. So think of this as your traditional kind of scope 1, 2, and 3, and how we can reduce those within our own walls of manufacturing, product design, et cetera. The second part of the way we think about it is our handprint. So this is what we enable our customers, to do through our products and services. So this is where we think about our product design, how our customers are using our product, and how that can impact and lower the environmental impact for our customers. At a corporate level, we do have SBTI validated goals, and that drives our overall programs and initiatives within sustainability. So we are looking to reduce our scope 1 and 2 emissions by 30% as an absolute value by 2028 from a 2021 baseline. And under that same time frame, we are looking to reduce our scope 3 by 17.5%. So for those of you a little bit less familiar with these scopes, scope 1 and 2 is kind of more within our control. It's the gas, it's the electricity that we're using within our own walls and manufacturing. And the scope 3 is those up and downstream supply chain and services. So raw materials that we're purchasing, transportation, capital projects, things like that. So at Corning, we talk a lot about our legacy of innovation. And while we're here to talk about plastics today, a lot of our business is actually glass. And so that is a unique challenge I have as well doing sustainability within my own business, is that I have different challenges. But for over 60 years, we've been looking at our manufacturing processes and have been able to reduce waste in our processes of glass manufacturing. We also have a line of ceramic products that actually go into the cars and trucks that are on the road and have been reducing carbon through particulate filters for over 50 years. For the 11th year, we have been named an Energy Star Partner of the Year. So this is a reflection of our energy management program, where year over year, we're looking on reducing our energy. And we've also been able to really implement solar panels and green electricity. So we did rank, top in solar within manufacturing, but also received an award for Time's Most Sustainable Companies. And a lot of that has been driven by our energy programs. So we're always thinking about sustainability. This is not new for us. It's maybe new how we talk about it and some of our goals and reductions, but we are always looking to embed thinking into our attributes and our products. All right, I'm not going to read this whole slide to you. We have a full, like many, several page sustainability report, but this just gives you a snapshot of, in addition to those carbon goals, what are some of the goals across our businesses? So waste conservation, waste management, or water conservation, waste management, really focus on our supply chain and transportation, occupational health and safety, ethical business practices in our community. So a lot of times when we talk about sustainability, we only think carbon or the environment, but really it's much broader than that. So the opportunities are everywhere. The challenges, though, are many. And so that's what I will get into as far as, how have we approached the life sciences industry to reduce waste, reduce carbon, and think about product design, and what are the challenges? So, sorry, my animation is all over the place. I don't know what just happened there. I don't think you can't see my words right now, can you? Okay. I'm going to go out of presentation mode here for a second. I apologize. I should have run it with the animation here first. Okay. All right. Hopefully you're seeing it now.
Yes, we are.
So,
Sarah, you might want to put
various,
it into presentation mode again.
that's where I had the issue with the word. So I'm just
Oh, I
going to
see.
do this one for a
Fair
moment
enough.
without presentation mode, then I'll go back in. So different numbers depending on the source, but around 5% of global emissions are contributed by the healthcare sector. So that's just kind of the scope of the problem. When you talk to pharma and biotech companies, so they are some of the research labs, but not all. Many of them state a number above 75% as their scope 3, meaning it's all within their supply chain, and they're going to have to work with their suppliers and their supply chain to reduce. And lab spaces are some of the most resource intensive of any industry. You heard Avery talk about all the things that have to go on there: cleanliness, air filtration, the different amount of plastics. And so those are all in place for patient safety and for good reason, integrity of the research, but it does make it very resource intensive. So I'll go back to presentation mode here. So again, just kind of an overview of Corning Life Sciences within the broader Corning Incorporated. So we have products, mostly plastic, but glass as well. We do have a line of reusable glassware, laboratory equipment, and then single use for bioproduction, as well as our glass packaging business. So it's a diverse set of problems when it comes to waste because of the various workflows our products are being used in, all of those regulations that you heard about, and the different types of materials. And you can see combinations of materials as well. And I'm sure Jackie will speak to some of that in her presentation. So the way we approach our sustainability programs within our life sciences business is we focus on climate initiatives, so laddering up to those goals that we have from a corporate standpoint and how we can help meet those goals. Design for sustainability, so thinking about sustainability upfront in our innovation process and our product design. These are things like, how can we use less plastic in our design? How can we use alternative materials? And so this does take longer, right, to go through that innovation process and qualify the products, but that we're embedding it into our innovation. And then environmental stewardship, which is again kind of unique to Corning Life Sciences versus the rest of Corning, given all the plastic that we are generating with our customers. So for the purposes of this presentation and the webinar today, I'm going to focus on some of our initiatives, environmental stewardship specifically, and just where we've had some success and challenges. So one of the successes has been a Corning Recycles program in the Northeast. So we've been running this for several years now with customers. And Avery even pointed out that within a research lab, there's a little bit more room for an extra bin. And we can take some of those things like pipette tip boxes that are not easily recyclable by your curbside recycling or local provider. And so we have, recycled over 160,000 pounds of plastic through this program over its life. There are challenges, though. It's, kind of geographic based off of where our recycler is. It does not make sense to transport this a long way. And so, that's a limitation to the program. And we also still have to think about that hazardous versus non-hazardous waste, right? So we can only accept things that we know won't have interacted with hazardous materials. So we would love to expand this, but it's been, those are some of the challenges to expansion. So that's certainly something we can talk about. We're also thinking about circularity and not just recycling. So when you think about the circular economy, you can recycle it back into a different product completely. It can just go back into that general recycling stream, or it can come back into, the fully circular model of the products that you're purchasing. Today, a very small amount of plastics and recycling are actually going back into the economy. Again, different numbers depending on your sources, but almost always less than 10%. For us, the raw material and the purchased goods and services is our largest scope 3 emissions. So this is our biggest opportunity, but also our biggest kind of challenge as far as how do we tackle this number to reduce that scope 3. So the strategies around circular economy are not easy, but they can reduce your carbon emissions, and it could potentially reduce costs. It could also add costs depending on how you get it back in and what processing you have to do in order to make it a high enough quality to use again. And so this is all a part of our innovation process right now, as far as how do we potentially solve this problem and kind of create a new waste or a recycling stream, right, to bring back into our products and our feedstock. So again, within Corning, as we work on circular solutions, we think about first life cycle assessments to really make sure we're validating that environmental impact end to end and understanding, okay, if we bring back in recycled content, what does that actually do to our carbon footprint when you add transportation back or the processing back? And so we've built some internal capability to be able to do this, to make design decisions without having to go through necessarily a third-party verification process. Then we can make strong design decisions and integrate that sustainability thinking into the design of our products and our supply chain. And so we're looking for solutions that either extend the life. One example being on the right there, you see what might be in many of your hands right now, an iPhone, which is Corning Gorilla Glass. And over time, as we've strengthened that, the glass has gotten better and better. Hopefully you've noticed if you drop it, you don't get as many cracks on your screen. And so that extends the life of the iPhone. Reducing the environmental footprint of our customers. So the example there on the right is from our pharmaceutical technologies business. We've reduced the amount of glass in our Viridian vial. So again, at that end of life, at our customer footprint, it can help reduce the impact. And then of course, reuse, recycle, and repurpose as much as we can. So I've mentioned a few of these already, but this is really, my view of all the challenges to circularity and recycling. Reverse logistics. So we distribute to thousands of labs across the globe, and we do that through distributors. Getting that back as a waste stream is really, really difficult, maybe not practical, and maybe not even carbon efficient. And so that's one thing that we're thinking about is what is that kind of reverse logistics? There's a lack of recycling technology. So when you think about mechanical recycling, it's widely available and pretty relevant, but has limitations. Chemical recycling is just starting to kind of evolve from a technology perspective and build capacity. The cleanliness, we've already talked about this a lot, and Avery touched on it, of what does that look like? Is it hazardous? A pipette tip might be totally fine to recycle depending on what my customer used it for, and I don't know. And so that's something that we have to understand, and then work through all those, local waste regulations. And even when we're thinking about country to country, right? Because we are a global company. There is a financial investment. So yes, long-term, there's a sustainability benefit and there's potentially a cost savings benefit, but there's usually infrastructure to set up one time ahead of time. There's also quality and the degradation of the plastic over time. So as it goes through heat cycles, either because of the workflow it's used in at the customer, the cleaning it's required to go through in order to come and get recycled, heat cycles of the recycling, and then the heat cycles that it's going through back into the process. This all changes the quality of the plastic. And we are working to understand that and understand how much can it take before it's no longer suitable to meet our quality requirements. And then customer acceptance and partnership. There's varying, I would say, levels of openness as to how we do this, and people, some customers being very conservative on some of these rules and trying to make sure that they don't have a liability going out the door, to make sure that there's not a mix of hazardous material, et cetera. So all of this requires partnership and collaboration, which Jackie and I have worked together quite a while now, between MilliporeSigma and Corning. And this is just an example of a workshop that we had in June that we were working to try to get kind of buy-in on some of these problem statements and the strategy and prioritize initiatives. But ultimately we paused. There's so many competing priorities to complete this circle and so many challenges. We really need to start small, but we are definitely interested in these collaborations as much as possible. Sorry, Gretchen.
That's okay. Sorry, we're a little over time though. Thank you very
I'm
much.
all set. That's my last slide.
Fantastic. Thank you very much. All right, appreciate that. Next up is Lara Capelucci. Lara, take the screen, please. There you are.
All right, I am going to take the mic, but not the screen. Megan is going to drive for me, so thank you, Megan. And apologies if I have a few transitions where I need to say next slide. I'll do my best. Laura Capelucci, I am the Global Sustainability Lead for BioLife Plasma Services. We are part of Takeda's plasma-derived therapies business, and we operate a network of over 250 global plasma donation centers, the majority in the United States, but also in 3 countries in Europe. And I was not familiar with the plasma-derived therapies field until I came into this role. My background has been in sustainability and clean tech. So I'll start with just a brief overview of the plasma donation process. So we start with our network of plasma donation sites where we have donors that come into each center, complete a plasma donation, and then that plasma is sampled and tested, frozen, and shipped to our manufacturing plants where we create plasma-derived therapies, and then these are distributed to patients worldwide. And what I learned is there's actually no substitute for these therapies. The only way that these patients can have treatments is they rely on this network of plasma donors, and often thousands of donations a year are needed to sustain a patient and their annual course of therapy. So it's absolutely a critical, life-altering and saving process. However, it generates a tremendous amount of single-use plastic waste, which is the theme of the day. So Megan, if you would add the animation. At every step of the way, from shipping products to our centers, to conducting the plasma donation, to sending samples to labs, to sending the plasma itself to manufacturing, and then ultimately at the other end of the business, when we commercialize and ship our product, there are single-use plastics involved. And our goal is to reduce the amount of single-use plastic waste, but with that comes some complications, many of which have been highlighted by the speakers, but I'll speak to it from my perspective on the next slide. So some of these were just brought up by Sarah, and we share some of these same pain points. We have a massive network of plasma donation sites, and of course there are other companies in this space as well, but all of our sites are relatively small and distributed geographically, which leads to this reverse logistics challenge. And how do we solve our landfill problems without creating a scope 3 emissions nightmare? Then the kits are made of mixed plastics, and it's great to hear from folks like Corning that are working on material changes and creativity and innovation in design. But right now, our donation kits have over 17 different types of plastic resins. Some of these still contain PVC with DEHP, though there are phase outs happening. And after the plasma donation is complete, some of these plastics are contaminated and then considered to be medical waste. Some of them are not, but they may have other liquids on them, and they're all mixed up together. And separating the plastics after they've become contaminated is not possible from a health and safety perspective, and separating the plastics before contamination can be highly challenging from an operational efficiency standpoint. And then finally, we're operating in a highly regulated industry, which is for the best. The health of our patients and the health of our donors is at the forefront, but it means any changes that we make to the materials or even to the packaging is considered a change to a medical device and is regulated accordingly. So these are the challenges that we're up against, but we are here today not to throw our hands up or say it's impossible, but instead to look at how we can innovate, collaborate, cooperate together to drive the entire industry forward. So taking a look at just the growth of the industry, just to highlight the urgency here, which I think based on the number of people on the call today and presenting, this message is clear. As the industry grows, I chose the plasma industry, but I'm sure you could fill in the blank with any number of industries within the biomedical space. There is a mounting plastic problem as well. And to tie it to New York, because we're in New York Climate Week right now, the estimated over 20,000 metric tons of plastic waste a year generated from the plasma-derived therapies industry would be 1.5 Brooklyn bridges or almost 100 statues of liberty of waste every year. So as demand for therapies grows and as the industry grows, so too does the amount of plastic waste, which is all the more reason for us to be looking for solutions together. So just to share a bit about the solutions we have on the next slide, we looked at our options, and if you'd advance it again, thank you, Megan. The first thing that we can do is look at options for waste diversion. So looking at the materials coming out of our plasma donation centers and what we can do with these materials besides landfill or incineration. And some of these options require off-site remediation. So if it's medical waste, it would then be treated at a facility off-site. The medical waste would be neutralized, and then that would enable additional options for recycling. We have also started to look at devices and options where we could be doing some of this remediation on site ourselves, especially at our labs where we do have some more high quality plastics that are easier to recycle. And then after we have rendered this material non-hazardous, it can then be recycled. The next layer that we're hoping to work toward, especially through these conversations and collaborations, is looking upstream at the materials coming into our centers to say, where can we reduce materials? We've had a successful program looking with one of our suppliers at packaging and how we can reduce packaging to just cut down on the amount of waste coming into our systems. And then in the long term, are there changes in material that make sense that would still allow us to achieve our core business in a safe manner, but with a material that can have a longer life or a different end of life? So we are focused in the near term on diversion options, but keeping this multi-time horizon in our plans and how in the long term we can work toward fewer materials and different materials that are more environmentally sustainable. So just to close out, these source reduction and material changes will require us to all collaborate, align on our priorities, but if done successfully, have a tremendous impact potential. And just looking at how solutions that make sense in just one plasma donation center or lab, or just at one company, can be scaled across our industry and, of course, industries with similar waste. So when we're looking at solving problems within BioLife, we are more than happy to be sharing what we're finding, sharing our pain points with not only the rest of Takeda, but with the broader industry and related industries that you see represented here today. So excited to be part of this conversation and openly share our pain points and hopefully hear some creative new solutions we can come to together.
Thank you, Laura. Fantastic. All right, our last speaker for the day is Jackie Hollins. Jackie, take it away.
There we go. Hopefully you can see my screen and you can hear me okay.
You're good. You're good.
Excellent. Thanks. Thanks for inviting me to this. I've just learned a few more things myself today in listening to everybody's presentation, so thanks for that. I'm Jackie Hollins. I do work for Millipore Sigma in our Sustainability and Social Business Innovation Group, and I've been leading our product recycling programs and initiatives and innovations since 2013. So let me jump in to a little bit about us. Millipore Sigma, similar to Corning, we also serve the life science sector across everything from research and development in academia on up through to biopharmaceutical and pharmaceutical manufacturing. And so with that comes quite a challenging and complex and diverse set of things that we need to do. We are owned by a larger company, Merck KGaA, Darmstadt, Germany. And through them, we have committed to our goals, our sustainability goals here. I'm not going to get into too many details here, just for interest of time, but do know that we are dedicated, that we have SBTI approved goals for our emissions reductions. And here are the three main goals that we have: the dedicated to human progress. The priorities for us are for the life sciences sector, really highlighted there in the white, the sustainable innovations for technologies and for our customers. And so we do that through many different things. You've heard design for sustainability already. We also implement that as well into our technologies. And then, of course, our supply chain is an area where we have to be very concerned because just like our customers, 75% or more of our emissions are in our supply chain as well. So working with our suppliers to really reduce their footprint, which then reduces our footprint, and so on and so on. And then, of course, reducing our ecological footprint. We've got our goals for by 2040 to achieve climate neutrality, instituting emissions as well as renewable electricity across our manufacturing sites, and our water and waste resource intensity. And so, again, high-level corporate goals that are, of course, being aligned to and delve down into our life science sector in many different ways, and very complex. Now I'm going to really zero in on what I do and what my team does. So I'm going to be a little bit selfish here, but I'm going to really push into what are we doing around our products and recycling, and specifically around plastics. That's where we've been working for quite some time. And in 2020 to 2022, we redesigned and redeveloped our strategy around recycling. It's no longer just recycling. We have to be looking at closing the loops, and we have to be bringing in our minds, bringing that plastic back into the life science industry. You've heard that all, I think, through everybody's presentations here. I think we're all in agreement that changing the materials in our products is going to be a much bigger, faster way to reduce the ecological footprint of the products. And if you just look at scope 1, 2, and 3, and you look at scope 3 and the categories there, scope 3.12 is not going to be the major lever to reduce the footprint. You really have to do it in the materials. So while we're still going to be trying to solve the problems of recycling single-use plastics within the labs, we're also starting, you look at the little green car down at the bottom there, we've started a program, a greener polymer strategy. So making sure that we're implementing the newer, either bio-based and or reduced footprint plastics into for products. So making those changes for our customers like Takeda, as Laura mentioned, or change them altogether where necessary. This is not something that's going to happen overnight. Mechanical recycling is not going to be the way we are going to be able to get there. We are going to have to rely on chemical recycling or advanced recycling, as some people call it. That is emerging. It's not completely at scale, but there are technologies that are not as resource intensive as the first types of chemical recyclers that were out there 30 years ago. Things have improved, and there are some really exciting technologies that may get us to this goal that we have. We as a company, the Life Science Division, we are looking to neutralize our consumption of plastic as well. That's the goal that we're trying to reach. And we'll do that through the recycling programs, but also through our greener polymer substitutions as we go along doing that. We have been at this for a while when we talk about recycling. In 2015, we launched a partnership with Triumvirate Environmental here in the East Coast of the US. to address the biopharmaceutical single-use plastics. That program's still going on, and as of the inception in 2015 to half year, this half year 2024, we've recycled over 12,000 metric tons of plastic into that program. We feel that that's a great step forward. It's still a really great program. We did a life cycle assessment. If you're within a certain distance, it really does reduce the footprint for the products and for your end of life situations. But we also feel we need to do better. The plastics that are being used here, I'm sure some of you've gotten the indication from some of the other presenters here, the plastics are really pristine. We have to have plastics that don't leach something into drugs or into things that are being injected into humans and in our medical systems. And so we're sort of looking at it as we really do need to get these plastics back into a circular situation. And while going into making plastic lumber is a definite best use and extending the life of those plastics, there are things we feel that we can do better. And so we're looking to do better with that as we move forward. Now, that's biopharma manufacturing. Biopharma, we think, have probably anywhere between 200 to 400,000 metric tons per year generated plastic waste in that single use. When we start to turn and look at research labs, and this is just the research lab, so not the hospital space here, we believe it's anywhere between 5, maybe 10 million metric tons produced globally on a yearly basis. Put that in perspective, that's filling an Olympic-sized swimming pool with this plastic waste that you see on this picture every hour of every day of the year. So that kind of gives you an idea of the volume. Now, just like this picture, that waste, that plastic is multiple types of plastic, and it's also all mixed together. And there's also some chemical as well as biological hazardous material in there as well. And so we have to be very careful and understanding what's going on and what to do there. So we've decided to set out and look at how do we really develop recycling programs that, one, create those closed loops, bring that plastic back to our supply chain or the life sciences supply chain, either in products or packaging. That's our vision. We want to make sure that we're reducing the waste, but also the carbon reductions for our customers, and then driving innovation within plastic recycling technologies. This is maybe seen as a niche market, but it could be driving some of that adoption of chemical and advanced recycling technologies and may actually really prove those out much quicker than, say, the municipal waste streams, where it's not really a best fit. And then, of course, increasing the sustainability of our plastic products, that greener polymer strategies that we talked about. And as everybody has said here, it really requires a collaboration across multiple sectors and partnerships and willingness to do some things across the board in order to make a program actually come about or happen. So we started out in a year and a half, 2 years ago now, looking at how do we figure out what to go after in the labs, in the research labs, and also biopharmaceutical manufacturing. Where do we start? And unfortunately, there's not a lot of data. When we come up and we say, all right, we want to do a recycling program on plastics, and I go to talk to a recycler, that recycler is going to say, what type of plastic and how much do you have and where is it located? And that data just doesn't really exist at the level of the type of plastics. And so we set out to really start to talk to our customers about what's in your bin, because that's what's really important. It's one thing to say what you've bought and what you're consuming, but what bin does it actually end up in, and how much is in there, what types of plastic are in there, is really what we need to get at. If we don't get there, if we don't do that kind of data analysis, then we really are just constantly going around and around. We also figured out very early on, we had another recycling program along with the Biopharma recycling program that was a one product, one box type of recycling. And there's two main things that came out of that. One, the volume wasn't there, but the second one was engagement was very low for that product. And so we found that if we looked at just a specific Millipore Sigma product and tried to do a recycling program around that, we'd spend a lot of money and we'd get very low engagement in those programs. And that's, you can see that even in the municipal world, in the consumer world, you don't get above maybe 30 maybe 40% recycling in certain instances, but really 30% is what we've been seeing. And for us, our recycling program never got above 1%. So we had to really take a step back and say, how do we engage our customers? And what we found is they don't really understand where their waste goes. And so we thought, well, let's set something up to really engage them and also get that data that we needed. And so we set up a pilot. We're doing it in the UK. We focused in regions and here in the Northeast of the United States. And we've got some select customers that have been engaging and doing waste assessments for us. We created a tool, and this is just an example. This actual slide is from a lab, an internal lab at our own site, just to give you an idea of the types of things that we're trying to understand. And so we're looking at what types of work is the lab doing, how many people are working in that lab, and then which bins do they actually use? Where does this plastic end up? Right. And so we got them to sort of start to do that. And then they fill out the tool with all the different things. And there's two ways to do the assessment. Most of our customers opt for looking at what they're purchasing. And so they go to procurement and they figure out all their plastic purchases and they fill out the tool with all of the items that have plastic in them and then label and attach what types of plastic are actually in there. So a pipette tip is made of polypropylene. They put that in there. And then the weight. And then, of course, they track and trace and say, where do the most of these tips, where do they end up? Which bin do they end up? And so it's a little bit of an estimation, but it at least gives us some data that we can work with. We do have some customers who actually spend a week and they weigh and measure everything and then they keep track of it that way. And so we do have that data as well coming through. But this is sort of the front end to really show you that we really want to get a set of data that gives us a little bit more information on what types of plastic are going to track to what types of work people are doing. Here's some data. Yes.
Just coming up on time. So.
Okay. Here's some data that we got from the labs very quickly. Notice polypropylene, polystyrene. I think most people would say, yeah, they're not surprised by that. But then when you start to look at it from a CO2 emissions perspective, your polystyrene actually goes higher than your polypropylene. And so very important to really get a proper footprint around plastic. This is something people weren't talking about either. Like, what's your carbon footprint around your plastics? And so very important to have that. This one I'll just show you very quickly. Again, the items show up. So we're not just tracking by the actual polymers there, but the customer now can look at what items are they using and where can they maybe reduce. In this instance, they had flasks and bottles that are made of two different polymers. Is there a way to use one type in there and give them more data and information to benchmark and also match changes that they make? Preliminary results, we are right in the middle of analyzing things, data's coming in, but I just want to say that this plastic waste, anywhere between 50 to 100% of it is going to end up in a biohazardous waste bin. So that's a lot higher than I thought it would be. What I had seen before was anywhere between 15 to 25%. But when you really drill in, you find out that that's really a problem there. In this particular situation, 3 tons of waste in this one lab, 1.38 million items in that waste. So it just sort of starts to really rack your brain with, oh my goodness, there's a lot of things in this waste. But we have found that the data really helps drive our customers' engagement. And now they are committed to doing the next phase of our pilot, which is developing recycling programs where we can actually recycle that plastic back into something of value within the life sciences value chain. I'm not going to get into too much. I think we know layers of complexity around this waste, but the biopharma waste, we're doing the same there as well. What we're finding there is the complexity is more in the products themselves in that waste stream versus the actual waste management and handling. That seems to be standard across and the way they handle the waste. So with that, I'll just end with this slide. We're here at Waste Characterization. This is the sort of partnering to excel and generate greener polymers to come back into our own products. We're really in between that 1 and 2 now. We've got some education. We know about some advanced recyclers. We've got some other technologies, and we're starting to partner with those pilot participants and figuring out those next steps for 2025. And then, of course, at the same time, we are testing and incorporating bio-based as well as any recycled content, plastics and polymers into our own system. So we're trying to get ahead of it. We're not waiting for recycling programs to happen before we actually can start to produce products that have a reduced footprint. And I believe that is my last slide, and I hand it back to you then.
Thank you very much, Jackie. All right. Thank you to all of our presenters today. I think you've done a great job of kind of outlining some of the challenges, where you are headed, and what your organizations are thinking to do. I'm glad to see this dedication to sustainability in so many different forms. And yeah, the scope 1, scope 2 is more controllable, and scope 3 is more of a challenge, trying to get to work with your vendors and go upstream. So I wanted to make a couple different comments. One, I just want everybody to visualize what a ton of plastic looks like. That is just crazy. Okay. It's like kind of like a ton of popcorn. Yeah, that's a lot. It takes up a lot of space, but doesn't weigh that much. So when you see, 12,000 tons, that's an enormous amount. So any of these numbers are a huge gain. We touched a little bit on the idea of it's got many names at this point, but the chemical recycling, advanced recycling, molecular recycling, it's all the same thing. Basically breaking down this plastic to its base components, and so that it can be made into something new. And just so you know, that will be on our next webinar. So next week, you can hear more about that option. And in some cases, that is, the option if you have a lot of mixed plastics, like Laura was talking about. Sometimes these items have as many as 12 plastics in one item, right? So very hard to recycle that in a manual way. Avery, I wanted to ask you, this is something that you and I talked about once. How many waste streams did you tell me are in a hospital? Do you remember the conversation?
Yeah. So we're currently tracking 26 different waste streams.
26 different
yeah.
waste streams. Okay.
So I guess there's probably more than that, but that's at least what we've identified flowing out of our facilities.
Sure. And that 26 is a lot, which means that you've got any number of bins under any number of tables in your room, right? And that's a lot to ask people who are supposed to be doing things like surgery. So it's yeah, it's a lot. So a lot of challenges there. All right, so I'm going to start off by asking a question across the panel, and feel free to put your hand up if you would like to jump in to answer. One of the biggest factors for a successful sustainability program is getting buy-in from other people in your company. So please tell us how you got buy-in for your program, and at what level did that momentum start? Was it with the CEO? Was it with your shareholders? Or was it ground level and worked its way up? Anybody like to volunteer? Oh, Laura, go ahead.
Unmute, Laura.
You want to unmute. Yep.
That would be helpful. So we're in the fortunate position at Takeda where there's a tremendous amount of support from the top down. We have well-established net zero goals for carbon as well as zero waste goals for waste. And what my team's role has been is really translating those high-level goals for the organization to practical ways that our staff within our plasma donation centers can take action. And again, what you were saying about people in the hospitals are doing surgery. Most of our staff are phlebotomists or lab techs, and just finding a way to translate what this goal means in their everyday has been where we found success, and making sure that we're always starting with the why and connecting planetary health to human health, because so much of what drives our employees to work in this space is this commitment to better health. So when we connect planetary health to human health, we find that there's a lot of enthusiasm for acting in our programs, even if it may mean a change to day-to-day operations. But we also do our best to get buy-in from the operations team and make sure that what we're suggesting is reasonable. So 36, 26, whatever you said, waste bin's probably not reasonable, but changing the process for how we're filling boxes of waste is reasonable.
Okay, thank you very much. Sarah?
Yeah, we're a very matrixed organization as a company, meaning we have divisions, we have functions, we have top-down leadership, and there's all sorts of fun, solid and dotted reporting lines as we work together. So for us, it has to come from multiple angles. The external pressure really drove the top-down goals several years ago, right? So it was the market and investors saying, you must do this as a company. And that drove the top-down goals that was able to cascade to the different functions. But when it comes to product that is owned by our divisions, those different businesses that serve different markets, and so it was really the voice of the customer and what some of our competitors were doing that allowed us to drive from a general management standpoint, my senior leader to say, this is important for our business and for our customers. And actually, we find we have more pressure, more asks from our customers than even the rest of our Corning business because of the problem within the life sciences industry, and our customers are setting aggressive goals as well. And then you have the bottoms up. You just have the people that are passionate about it, that want to make it a part of their day to day. And we have, an informal employee network and resource group that is driving some of those bottoms up initiatives and employee engagement. So that's how we've had to approach it for us.
Excellent. All right. Thank you very much. Avery, Jackie?
Yeah, I'm happy to jump in here. So for us, it really did start with a grassroots movement. So fun fact, we were one of the first hospitals to remove mercury thermometers back in 1998. So that's our claim to fame. Now there's a lot of other claims to fame as well. But so for us, it really started with kind of a grassroots movement, which after that point culminated in kind of a do one thing each year, which ultimately led to physicians asking for this, as well as some of our patients. So some of our patients noticing we weren't recycling and we didn't have options to recycle across our facilities. And of course, that's one of the most visible things that a patient's going to see. And so that was really kind of what got leadership support. And to Laura's point on the connection to human health and why all this work matters, our physicians have been some of the largest voices there, and we have a lot of physicians actively engaging in climate-related research and its connections on human health. And so looking at how do we intersect that across our organization. But ultimately, grassroots efforts blossomed up. And then since then, our leadership team, through the creation of a steering committee for sustainability, that ultimately kind of drafted the goals that were presented through our leadership team with an executive sponsor, was then pushed down from there. And so I think I showed a slide with our governance structure. So we have a number of different working groups now that are ultimately all their work filters up through our leadership team to show and demonstrate progress on our commitments and be able to actually highlight how our pilots are scaling to programs, and our programs are having an impact across organizations. So it started grassroots, and now it's a mix of really being across the organization and having opportunities for any level of employee to get involved, but then also making sure that we're moving our goals forward in the long run.
Nice. There definitely are some things that can only be done from the top. And then there's also that amazing pressure from, employees, doctors, and social pressure, right, from the outside. What are you doing to make this better? You're a big company. You should be helping, right? Jackie, did you want to add anything?
Yeah, I mean, I think I reverberate what's already been said here, particularly with Sarah, with customer pressure and those kinds of things. But from a team perspective, I think we've been able to influence maybe, and also work with the above us, but also below us with data. And by being able to sort of prove that you can actually make these changes, sustainability brings innovation. It brings innovation to your products. It brings efficiencies. It can be a cost-saving thing. And so those things speak volumes as well. And I think that definitely, I think our movement to in this field, in sustainability, has always been supported, luckily, by from above. But the data is really what grabs people and makes them move towards something that can really prove that you can make those changes. And then, of course, people just they see it's needed, right? They see it's really important. We have regulatory coming at us now with substances of very high concern and things going on the REACH list. And we're a global company. We have to be paying attention to that and looking for different materials and changing. And so, not that I think sustainability should be out ahead of that. You should be doing things out ahead of that. But those things are coming, and we have to be able to move and change in that way as well. So, yeah, a lot of drivers that come in.
Yeah, no, people, planet, and profit. So yeah, no, it certainly can be a money saver if you're, buying less and making less waste. It costs to create waste, right? So fantastic. Thank you. Right. So one thing that was briefly mentioned, but I'd love to dig into more is, what do you see as opportunities for collaboration? All right. How do you see that working? Who are you interested in working with, and why? All right. Anyone want to field that one? Okay, Jackie, back to you.
Obviously, customers first, right? That's where we're really hitting the road, as I mentioned in the pilots that we're doing. But we also need collaboration from I don't want to just say waste management, because I think that's a really huge group. We really need the logistics, the ones that pick up. We need the technology providers that are looking at how do you treat waste. This is a lot of biohazardous waste, and yet it's really good plastic, and we can get there and recycle it if we can treat it properly. So definitely in that space. And then those waste management that are willing to look at separating on a shred, not separating on large things. So really starting to look at the technologies that can move us to separation of polymers and plastics in that space. I think where we're talking about bins in labs, and that just it's not gonna cut it. We can't always change the behavior at the bench or the behavior even at the dock. We may have to be relying on doing something with a mixed shred of plastic. And so that's where I would say right now we're really needing that sort of coming together and finding those companies that have those technologies and want to move forward. And then that links, of course, to advanced recyclers or recyclers in general. Those are the main places I see.
Okay, sure. Thank you. Laura?
Look, I got my mute that time. So I think absolutely we need to collaborate up and down and across the value stream. I would say we're always looking upstream at our suppliers to say, how can we change the materials that we're receiving? But there's also the element of looking downstream and where can we innovate in how we repurpose these materials. And I love the example, Avery, that you gave of looking to adjacent industries even and saying the ice packs could go to the dairy industry. And, we might be far away from true circularity of saline solutions being turned into new saline solutions, but are there other industries that could maybe accept our remediated waste into their new materials? So I think a lot of collaboration has to happen in these circles, but also just keeping an open mind to where else we could go. And there was a question in the Q&A about openness to pilots and studies. Always open to pilots and studies. I don't think that the solutions are obvious, and we're going to need to try many things before we find something that works.
Sure. I'm going to just throw that out there because I've done it before, which is matching up student groups in college, for instance, they're material science students who are then and match them up with something like one of you, and they have some very creative ideas. They have yet to get into a mindset where they're thinking what somebody has taught them to, and they come up with some doozies. So I highly recommend that. Avery, you had your hand in the air.
Yeah, so agree with everything that's been said, but kind of focusing in on the healthcare space in the world that I'm in. A couple, I'd say, areas for collaboration and opportunity is historically there's been a lot of devices that are reusable in the healthcare space, but unfortunately over time we've been moving more towards single use because of how they're designed, and it makes it very difficult to disinfect and sterilize, and the instructions for use as well on how to properly disinfect and sterilize makes it extremely burdensome to interpret and make sure you're doing appropriately from a regulatory standpoint. So with all that said, I think there's a lot of opportunity for collaboration between our infectious disease and infection prevention professionals in working upstream to properly design equipment to maybe have the chance to actually be reused. So instead of automatically switching to disposable all the time, asking the question, can we just design this better? Is one of my major wish list items out there as I watch every scope switch to single use across the hospital. And I'd say the other area of like looking downstream is obviously we all know how high volume plastics is and how light it is and how financially not viable it is right now to send out to be recycled. And so, but thinking creatively about our local, the other organizations and other hospitals within our area to see if we can coordinate the reverse logistics of almost a milk run to make it a larger pool of plastics at once and able to kind of service our facilities more often to get this material off our sites in an efficient or more efficient way. But those were my two, I'd say, ads. Besides, a lot of collaboration is needed, and always happy to pilot. We do work closely with MIT as well as Harvard and PhD students to kind of dive in and research these questions further. But always happy to partner externally as well.
Awesome. And just in the same way that you have, so many containers under only so much space under a counter for containers, there's only so much space at the dock for so many different materials. So yeah, having that milk run to pick it up on a regular basis is pretty handy. Jackie, did you have your hand up? And Sarah, I want to catch you. Okay. Did you have an answer for this one, Sarah?
No, I think I agree with a lot that's been said. It's just, it's more than one, it's more than just you and not one other player, right? Like generally, even if I have a customer, I'm going to need someone else, my supplier or my recycler or someone in between. So it just takes time to work through some of these, and then there's competing priorities of those individuals as well. So finding the right pilot, the right scope, the right collaborators to align on a goal is really important.
Very true. All right. Well, thank you, everyone. And I'm understanding there are some great questions in the chat. So I'm going to turn this over to Megan now. And there you are. All right. Thank you, everyone. And I'll be muting myself.
Megan, you're on mute.
Yeah.
Thank you. Yes, I was saying feel free to stay on, Gretchen, because we might have a question in there for you as well. But yeah, thank you all. So I'm going to jump around a little bit. There's a question specifically for Sarah here. The dedication to researching is impressive. How can Corning share the fruits of that with other producers?
Yeah, that's a good question. I mean, we ultimately are a for-profit company, right? And so when we do our innovation in material science, we are trying to capitalize on that from an end market standpoint. We do a lot with universities, though. I think those collaborations have already been mentioned as far as training future scientists and working with different universities on material science. And then, we've done actually a lot of unique business models where we have partnered with competitors, right, on technology. So if there is something that makes business sense to share, we will absolutely do that. And so, sometimes by licensing a technology, you can, broaden the adoption and get benefit there as well. So, I think we're open to all of those things that make sense, with obviously the caveat that, well, sustainability is important and it's not our only bottom line that we have to think about. So.
That makes perfect sense. On that note, we have a question here about from Alexandra Gueval, who's a faculty teaching circular economy to engineering college students, who says, what would you tell, and this is for everyone, what would you tell to university students about what companies are doing and what skills they should learn to get a position in your company in the area of sustainability? And in parentheses, he has often perceiving that companies and politicians are doing very little about climate change. Does anyone want to respond to that one?
I can start. I would say two things. One, research the company and are their goals and commitments real, right? If that's what you want to work on, so that you know that when you step in, it's going to be something that's funded and prioritized. And then two, I would say as far as skills to learn, there's hard skills that you're absolutely going to learn with your degree, but it's some of those soft skills, particularly challenging the status quo. So the number of times in a big company that's been around 170 years, like Corning, that it's like, it's just the way that it's done. That doesn't work for the future. So we need young minds to come in and really challenge things.
I would wholeheartedly agree with that, Sarah, that I don't call that a soft skill. I call that a needed skill, right? Like we just need people to be able to challenge the status quo. If you're looking for something really specific, and when you say engineering students, how do we solve some of these things? And of course, I'm in the world of data, right? How do we solve with data? How do we solve with AI some of these problems, modeling or figuring out, what's going on in the supply chain? We've talked about, oh yeah, we're going to change our materials, this, that, and the other. That is not an easy thing. We have over 300,000 products on our list. As I'm sure Corning has probably similar, but below that, there's all the bill of materials and all of that data and information. And by data, I don't just mean numbers. There's so much there. And we really do need good data scientists and people who are thinking and working in that space as well. So that's number one, from a skill set perspective. And also, yeah, thinking outside the box, challenging the status quo, but also looking for things that are going to be, how can we look at this differently? How does this really affect us, not just here in the US, but in other places in the world? What is really happening, and thinking about that bigger picture, systems thinking, those kinds of things, I think would really help you in a sustainability role as you go forward.
Thank you. Gretchen, jump in.
Sure. I would, their soft skills, I would suggest, first of all, tenacity is one of the biggest, most important things you can have, most important qualities for a person who's going to succeed in this field. Okay. And it is just because it is challenging. You're going to run into all kinds of opposition, and you have to say, yep, I expected that. That's okay. Right. And then find the people who will support you on that journey and, get together. But I also would like to say that something that I've learned has been incredibly valuable is the ability to make the business case. So, if you are working at, let's say it's a hospital, and you're trying to say, we need to do this better, we need to recycle more, like, can you say how that would save money? Can you say how that would make a good story for the public, right? How can you sell that to the people who may not be as focused as you are on saving the planet or any of that? So it's about being able to kind of speak to people that are not focused the same way you are on sustainability.
Thank you. Yes, definitely agree. There are many benefits other than just the let's save the planet, which is great, right? So there are some specific questions in the chat that I invite you panelists to look at and answer, just in case I don't get to them verbally here on this platform. But here's a question for everyone. How much source reduction is being pursued, especially in packaging? I think that was touched on a little bit here and there.
I can start. We don't have necessarily public goals around it, but sterilization and the integrity of the product is really important in our industry. As a result, we have things that are sometimes triple bagged and then in a box, right? And so we find a lot of opportunities to say, how can we reduce that amount of packaging? And it's not necessarily an easy change. I won't say that. There's still, things that we have to go through, but it is an easier change than the product. So we're kind of thinking about outside in on how we can make changes.
Thank you.
We as a customer are starting to ask for these changes as well. But yes, absolutely, the outside in mentality, knowing that it might take longer to change the device itself.
We have an actual smash packaging strategy that we go through, and it's the shrink, reduce, those kinds of things. But as you can imagine, a global company with multiple distribution sites across the globe, over 100, you may have many different things happening. So getting our heads around that. And then, of course, some of the products, like Sarah just said, some things are packaged for sterility, some things are packaged for safety. You can't necessarily change those things at all. So really looking for the places where we can change and really reduce, or even change the types of materials. So changing out a styrofoam for or EPS, expanded polystyrene, for things like paper and things that can be recycled, but still can function the same way. Those things are definitely happening and making those changes as we go. But I hate to use the word evolution, but it's evolving, right? We have to continue to do it, and you'll see changes as they go.
Yeah, since I just kind of building upon all that, similar to Laura, we are pushing upstream, especially when we see certain suppliers providing excess packaging of flagging that opportunity. But in general, also, there's a lot of pre-created kits, medical supply kits that come through our facilities. And we're also questioning if every supply that's in that kit should actually be in that kit every single time, or does it make sense to purchase some of those items separate from that? Because there tends to be a lot of automatic waste as depending on the procedures that are being conducted. I'm clearly not a physician, so I work very closely with physicians to ask those questions and make sure that obviously patient care stays top of mind. And if there's a second to run to the closet to get an extra supply, that's not going to put any patient at risk. But really, and also in terms of the surgical space, physicians have preference cards for the types of supplies and equipment that they need for each of their different cases. And so we do have an annual review process to make sure that those preference cards are up to date. Because as, again, technology changes, as procedures change, we want to make sure that we just aren't automatically adding supplies into those kits by default, or as physicians leave. To making sure that the next physician coming in, that actually is his preference versus someone else's. So definitely looking a lot on the reduction side, because that is ultimately where we can align the most on saving the most money and ensuring that everything we're doing on the sustainability side is in alignment with our financial operations.
Thank you. We have a lot of questions, so I think I will just end on one that a lot of us run into on a daily basis. This is from Mateapen. I have not noticed recycling for prescription medicine containers. What are available options, including laws requiring pharmacy to provide recycling bins in the pharmacies?
So I can take this. I am not necessarily an expert, and maybe Gretchen knows a little bit more, but these are generally regulated waste, right, that have to go to incineration because it's been used with a patient, often a needle, right, with a glass vial and with medicine in it. So I would say this is something that we haven't completely solved yet. We actually just met with a company yesterday, though, that is trying to tackle this problem, and they have methods to both separate the container. So if you think about a glass container, it usually has that rubber stopper and kind of a metal enclosure around the rim. So they have methods to separate those and to accept waste and clean them from kind of residual medication and biohazards. So it's an interesting problem. Again, it's one where we're saying, is this the right problem for us to tackle? Because while we make the glass, we don't make the full containers, and they end up in hospitals all around the world, in the bins all around the world, as far as sometimes the injectables, et cetera. So it's a problem that certainly people are out there thinking about, and there's starting to be some solutions, but it's definitely not one of the easiest ones to tackle.
Well, we do have to end there, but we will do our best to follow up with all of the questions that came in. Thank you so much to all of you for your expertise and participation in this conversation, and I hope we can continue it and continue the work that you've been doing and the progress you've been making. Have a great week. Have a great day.
Thank you very much, everybody.
Thank you very much, everyone.